In this video, we will go over the dashboard and preferences section in Population Health. For a lot of people, this will be the first screen you land on when you open Population Health and is customizable. Depending on your EMR, the dashboard will be your default landing page or main page for Population Health. On this screen, you can see easy-to-read gauge-style reports for your practice. There are 6 panels in all. The 2 on the right will always show CCM reports. The other 4 panels can be customized by clicking the cogwheel in the top right of the panel. The options for those panels will be displayed. Select the options you want to view and click Apply to change that panel. Additionally, these can be modified on the fly to change the data you are looking at. The program can further be customized through the Preferences screen. To get to Preferences, click the cogwheel in the upper right of the screen. This will open a drop-down menu. Select the Preferences option. The Preferences screen has several sections to it. They are listed on the left-hand side of the section. The Care Gap rules allow you to select which conditions you want to manage in the Care Gap section. There will be several conditions here by default. The number next to the condition is the amount of patients in that practice that have that condition. The list is sorted from the most patients to the least. This info is based off the patient's diagnosis. If you want to add a new condition that is not on the list, click the plus sign to add a new one. You will need to name the condition and then add all the applicable ICD-10 codes for that particular condition. The call text parameters allow you to set overall parameters for campaigns. These settings will apply to all campaigns in your practice. There's a scroll bar on the side of the screen to see all the options on this screen. Once you have entered your desired options, click Save. The Quality Measures section allows you to select which CQMs you will report on in the Quality Management section in Population Health. By default, none are selected. Scroll down the list and select the measures you wish to report on. You can select all by clicking the option at the top. Please keep in mind that the more measures you select, the longer your report could take to run. On this screen, you can also assign goals for the practice for each measure. For 2018, we recommend that you set your goal to 61%. Once done, click Save. Impact Analysis lets you put in base data for reports. This allows the campaign reports to report on more data. Enter the information in the fields and click Save. Patient data allows you to set certain defaults for filtering patients. You can set what patients are excluded from Population Health, consider only patients seen in a certain time frame, mark how many chronic conditions are needed to mark the patient at high risk. Once selected, click Save. Please note that patient data preferences apply to all practices in your group. The Application section allows you to select some defaults for the Population Health application. These include what page is your default landing page, what time zone your practice is in, and what the attributed provider type is for the practice. Insurance groups allow you to create groups of insurances. By default, the Chronic Care Management portion of Population Health will pull all Medicare patients with 2 or more chronic conditions based on CMS guidelines. So there is no need to create a group for only those. The groups would be used if private insurance would also reimburse for CCM. If you need to create an insurance group, click on the plus sign on the top right. Name the group, mark if the group is CCM enabled, and then add insurance companies to that group. Please note that if you do make a group for private CCM reimbursement, make sure you add all the Medicare plans to that group as well, as only insurances in that group would be used for CCM. Once the group is added, you can edit that group or delete the group. Also under the cogwheel, you have an option to manage patients. This lets you see your total patient population and upload CCDA files to the system if needed. The audit report lets you see all activity in Population Health, such as who logged in and what was done. If you have any questions or are looking for more individualized help, please reach out to your support entity today.